Hi everyone, welcome to AMSA Global Health podcast series The Global Round. Today I'm privileged to be joined by Dr. Adelene Hilbig. Dr. Adelene Hilbig is an emergency doctor who's completed a large range of work in rural and remote health contexts. She's done 4 assignments with MSF in Palestine, Myanmar, Sierra Leone, and most recently Yemen. Before we begin, I would like to acknowledge the traditional owners of the land we are both meeting on. I'm currently in Perth, so the traditional owners are the Whadjuk people of the Noongar Nation, and Dr. Adeline is in Brisbane, so the traditional owners are the Turrbal and Yagara people in the Meanjin Nation. And we would like to pay our respects to the elders past and present. Thank you so much for joining us today. Just to start us off, could you please tell us a little bit more about what got you interested in working in the MSF?
So hi. I think my initial interest really came from sort of working in different healthcare systems. I think there's a range of differences in the healthcare systems we have in different parts of Australia as well as internationally, which very much extends to not just how healthcare professionals are trained, but also the structure of the healthcare systems and how those have evolved or perhaps haven't evolved to support the communities in which they operate. And I think just a general interest in healthcare systems in different contexts was what sort of led me to working or hoping to work internationally.
Yeah. So I guess before you worked in MSF, what sort of context did you work in?
So I'd only worked in Australia prior to working with MSF. I'd started off working as part of my medical school training. I trained across predominantly northwestern rural Victoria, and then had spent some time working in predominantly Melbourne and remote or rural Northern Territory in Alice Springs before I started working with MSF.
Yeah, that's so interesting. I guess on the lines of rural work, um, kind of what did you experience working in rural context, and do you think that prepared you for like the work you saw in MSF?
Yeah, I think I've always been quite interested in working in rural and regional Australia, in addition to sort of international work. And one of the I guess sort of commonalities is that there's quite a different resource allocation in rural areas, and that comes down to a variety of different facets of healthcare. So specialty teams that may or may not be available in specific areas, as well as certain investigative pathways that may not be readily available. And that could include things like an absence of radiological imaging at certain times of day, so particularly overnight. And I think understanding a little bit how resource allocation works in different settings was important to me from quite early in my career.
Yeah, it sounds really interesting to see how like the rural context kind of translated into your international work with MSF. You've been on like many assignments with MSF, which is very exciting. I guess from that, what was kind of like the biggest highlight or most eye-opening thing you saw during your time with MSF?
Yeah, so I think that's a challenging question because I think there's been a lot of highlights for sure. I think probably broadly speaking, learning from the teams that I have had the opportunity to work with. I've worked with a large number of healthcare professionals from a variety of different backgrounds now, and I like each of them has taught me, a range of different skills, many of which are invaluable. Um, some of those are like quite hard clinical skills, I would say. So, for example, working with the team in particularly Sierra Leone, they taught me a lot about managing conditions like malaria or malnutrition, which were relatively foreign to me before I went to work there. But I've also learned a lot from teams in on all my assignments around sort of professional skills like leadership, mentoring, management, and crisis resource management. I guess they've also taught me a number of non-professional skills as well, that translate into other elements of life, such as compassion and resilience and empathy, often in sort of situations of significant adversity.
Yeah, it's really good to hear that you kind of get more than just, I guess, like the medical experience, but you could kind of get to develop those other skills as well. during your time in MSF. I guess you were mentioning that you learned a lot of different skills, and you're currently working in emergency medicine. So just to take a little aside, what kind of got you interested in like working in emergency medicine, and was that initially the area you thought you wanted to work in?
Yeah, so actually, no, I did not see myself having a career in emergency medicine to start with. My first rotation as an intern was actually in ED, and I didn't particularly enjoy it. I think I just found the combination of sort of acuity and workload and uncertainty really challenging. But I returned to ED a couple of years later. With regards to hoping to develop some skills around sort of managing undifferentiated patients of sort of different acuity. And I think at that time when I returned to ED, I just found I really enjoyed it. I found it professionally challenging, really interesting, right through from sort of like the patients and what they presented with through to some of the broader ED skills around kind of team dynamics and leadership and management. Um, and I would say probably a little bit to my surprise also shift work, which I hadn't expected. Um, so after I returned to ED, I actually did go and undertake my first assignment with MSF, which was an HIV TB medicine project, and I did find that really really professionally interesting and challenging. But I just found that I really missed the ED skill set. So when I came back to Australia following that assignment, I joined with ASIM and have been pursuing a career in emergency medicine ever since. But no, it was not where I sort of initially foresaw myself going at the start.
Yeah. I mean, it's really interesting to see that you didn't actually like emergency medicine until later on into your medical career. I guess that's kind of what comes up in medical school for a lot of medical students is we kind of change mind about our specialties like every 2 weeks. I guess I think you were mentioning that when you went on your assignment, you sort of missed that like work on like emergency. I guess in that case, do you think your like emergency training in Australia prepared you for a lot of the work you did and saw overseas, or do you feel like it was sort of missing that sort of like high risk training in different
Um,
situations?
I think like it's one of those things where I do feel a little bit like I can only speak to my own experience, but I would say that I found ASIM training really valuable in terms of developing a skill set that I found useful working both within the Australian context, but also with MSF. I think elements of that, it is quite a generalist skill set. There's a really broad knowledge base that includes pediatrics, which I've found really, really useful. It's provided the opportunity to develop, I guess, some critical care procedural skills. And part of emergency learning and training involves quite a lot of teaching, particularly the knowledge transfer between clinicians in the clinical environment. And I think I found that sort of skill set quite useful. Um, it also ASIM trainings also offers the ability to develop, I guess, leadership and management skills. So you see those demonstrated in the ED by your seniors on a daily basis, but you also have the opportunity to start to develop those skills from relatively early on in your training, often in conjunction with your senior nursing team that you're working with. And I found all of those sort of, I guess, kind of more hard kind of practical skills really, really useful personally. More broadly speaking, I would also say that emergency medicine, you're sort of operating at the front door. You're the intersection between the community and the hospital. And I think it just affords you an overview of the healthcare system that helps sort of, I guess, understand the position and the functionality of hospitals within a community. And again, I've sort of found that really, really valuable.
Yeah, it's good to hear it was really valuable for you. And I think what's come up quite a lot is those like I guess like soft skills that maybe don't get as emphasized in like medical school, like we're mostly focused on like just learning our content, getting through like those type of trainings, like those skills such as leadership or like working in a team. Do you think for any kind of like doctor or maybe medical student who's kind of considering applying for MSF, is there anything you think they could do in medical school to sort of prepare themselves for those situations, like to train their leadership skills, for example, like volunteering or rural remote work that you mentioned before?
Yeah, so I have, again, I probably feel a little bit like I can only speak to what I did because I feel like there's so many different pathways that one can sort of follow down in order to pursue a career kind of working in this area. So I'd very much just speak to my own experience. As we've sort of talked about already, I think it's really important to have like a really strong foundation in the clinical skill set of a chosen discipline. Uh, I think that's really critical. I do think working in rural or remote parts of Australia has been really useful, partly because it has allowed me to develop clinical skills, specifically sort of, I guess, focusing on things like history and examination, which might sound a little bit basic, but when your investigation pathways are really limited by resource constraints, those skills are absolutely critical. And I certainly think that exposure to environments where you don't necessarily have the full repertoire of laboratory or radiological investigations is useful in developing those skills. Um, I think I've certainly found pursuing teaching skills quite useful as well. So I've done some short courses in sort of developing teaching skills as well as actively sought out, I guess, informal teaching and mentoring on the ED floor. And I found that really useful as well because I think it's not just the hard clinical skills that that I found useful when I've been working internationally. Um, I, again, speaking very much to my own personal experience, I did pursue, I guess, tertiary studies in areas such as like public health, trop med, and disaster medicine. But whilst that has helped me definitely to develop a theoretical basis in those sorts of disciplines, um, and it has been useful. I would say that I've probably learned more about those disciplines from the teams that I've worked with than I did from the theoretical study itself. Yeah. Does that sort of answer that question?
Yeah, it definitely does. And I think it's really interesting to see that, I guess, sort of those more experiences kind of teach you and your personal experience more than like those theoretical studies as well. I think you sort of mentioned, mentioned like learning, teaching in tertiary studies. I guess elaborating from that, do you find that when you are working, I guess, in those rural, remote contexts or maybe in international contexts, do you feel that a lot of your role, as well as also providing clinical care, is also like teaching your patients, like almost like health promotion? Do you feel like that's a role you played in your MSF journey?
I would say with regards to and again, I speak very specifically about my own experience here. I think teaching has probably been more focused on the healthcare professionals with whom I'm working rather than patients. So, as part of my some of my previous roles, I've been in a position where I am teaching certain skills. So whether or not that is supporting clinicians in the development of history and examination skills, right through to some more procedural skills, such as supporting critically unwell patients and the procedural skills that we utilise around that. I would say my focus on teaching has definitely been more around supporting clinicians in the development of some of those skills. And uh, I guess there is a nice intersection there between how we train within EDs in Australia, in the sense that often how we learn here those procedural skills on the floor is a skill set that I've found is quite transferable to when I've gone to work in international contexts.
Yeah. That's very interesting to see that it's more towards, I guess, your healthcare professionals as well. And I think that's very important as part of like a doctor's life is to continue to train and also train others as well. I guess in terms of kind of like all the medical students who are listening out there right now, are there any challenges that you maybe didn't expect in your work with MSF that you faced during your time that maybe medical students should consider before they apply?
Um, Look, I think there's obviously lots of challenges. I think one that I have always been quite mindful of is that it does need to like I guess it's sort of there is often a lot of complexity around the contexts in which I've worked, and at times things like returning to Australia would have been very difficult, and at times was actually not possible. And so what that means is when I have gone to work overseas, I am mindful of the fact that coming back might not be easy, and as a result of that, I think you do miss a number of major life events, particularly for sort of friends and family. So I've certainly missed things like birthdays and weddings and babies, and I think that is a challenge that I was aware of, and I was mindful of when I started working with the organisation. I think everybody approaches that situation differently, but I guess it is a factor to consider that it does mean being away for periods of time, and it might not be possible to necessarily return home easily. Um, there is also, yeah.
Yeah, it's good to hear like the fact that like I guess some situations you actually can't return back. So having to I guess adapt to that and like just be mindful of that before you go on an assignment is very important as well before you start applying. I guess in that sense, how did you kind of manage to like kind of keep those connections with your family and friends while you're on your assignments? Were you able to contact them or was there ways you kind of communicated with them?
Yes, I think I feel like I keep saying this. I can only really speak to my own experience. But I have certainly been, most of the projects on which I've worked, I have been able to maintain active communication, with family and friends via like, internet and phone. Um, I personally tend to take a little bit of time off when I come back from both working overseas, but sometimes working in more rural parts of Australia, and just go and spend some time with family and friends, both sort of around Australia and internationally, to sort of, I guess, try and maintain some of those friendships and relationships.
Yeah. I think it's good to like just put aside some time for your family as friends as well. And knowing that it is possible in this work to like actually put that time is very important because our connections with people are also important as well as our jobs. And I guess pulling away from MSF, what other sort of work do you do outside MSF and your emergency work?
Yeah, so predominantly my work is just in public hospital emergency departments in Australia. So I've spent time working in Victoria, the Northern Territory, now Queensland. But yeah, that's predominantly what I do when I'm not working overseas.
Yeah. Sounds really fun. So you can come back to, I guess, like those like emergency rooms again and go back to MSF as well. And it's a really good balance of different experiences as well. Just to wrap up, we do have one more question. I guess if you could like go back to yourself in first year of medical student and give advice to yourself, what's like the one thing you would probably tell yourself?
Um, I think this is probably going to go back to the question about how I wound up in emergency medicine. I think I would tell myself to be a bit more relaxed about trying different rotations, as a junior doctor. And I would tell myself to take my time choosing a specialty. I certainly remember like a lot of pressure to get on a training program, which felt like it sort of started the day I finished med school, if not slightly before. But I think I would definitely go back and tell myself that it's okay to take some time to try some different things before figuring out exactly what I think I wanted to pursue, which I think is a bit lived out in how I found my way to emergency medicine.
Yeah, well, thank you so much for sharing your experiences and joining us today. I think we really like learned a lot from your experiences as well, especially with like I guess like giving yourself some space to pick what you want to do and like making some time for ourselves and our connections as well. We really appreciate your time today.
To find more about MSF, head to their website msf.org.au or their Instagram page at msf_ANC. If you would also like to learn more about global health and global health opportunities in medical school, follow us on Instagram and Facebook at AMSA Global Health.